In the ever-changing world of healthcare, are you looking to get advice and learn to prepare for healthcare challenges that you may face? Come join a conversation about all things healthcare and wellness with your host, Gavin Wiswell.
Welcome to the Healthcare Corner, everybody. And today's episode is going to be designed to talk to our older population, our seniors that are listening out there. And what we're going to be talking about today is PACE programming. And so PACE is an acronym that we use all the time as a skilled nursing administrator. And what it stands for is a program of all-inclusive care for the elderly, or PACE. And today we have two special guests with us from San Diego PACE here locally. And so for those of you that are listening nationally, we're going to make sure that we talk about the broad PACE program and what it does in your state and your area, but specifically how it affects care and improves care for those living here in San Diego locally. And so today we have two great guests. We have Alan Tornel and Laura Gonzalez. And Alan is the marketing supervisor and North County representative for San Diego PACE, which is a nonprofit organization here, which really helps seniors coordinate care to provide an individual approach to their overall health. And so what's a trend in healthcare right now is really understanding that individualized care matters, how you meet the person where they are, whether we're talking about social determinants of health, coordinating transportation, day programming, all of that. And so Alan, over his last 7 years, has helped really the underserved communities in San Diego understand what services are out there. And so we're very excited to hear from him on all the innovations and improvements with PACE programming and just healthcare in general for all people, regardless of healthcare. And our other guest is Laura Gonzalez, and she's the marketing coordinator for San Diego PACE in North County as well, and received her Bachelor's of Science in Psychology from UCSD. Both Alan and Laura are from UCSD, so we've got a lot of great perspective here in San Diego from all of our universities as well. And so her focus has really been to provide quality resources and coordinated healthcare services to seniors by implementing these processes and really advocating informally through mental health and other aspects. And so what we've talked a lot about here on the Healthcare Corner is whole person care. And today's episode, I think, is going to hone in and really give you a real life example of what whole person care looks at. So we're talking about physiologic, psychosocial issues, social supports and community supports that are out there. And hopefully you'll be able to hear some great examples. So without further ado, Alan and Laura, welcome to the Healthcare Corner.
Thank you so much for having us, Gavin.
Thank you.
Yeah, thank you for having us, Gavin. We're very, very excited. So let's get it going.
Absolutely. We were so great to have you here. And so on the Healthcare Corner, we really want to know who we're talking with. And you can always listen to past episodes on hcshow.net and understand more in detail. But the question we always ask is, what got you into healthcare? So maybe we'll start with you, Alan, and then Laura.
Of course, yeah, Gavin. So my journey with healthcare started very early on. First, as a recipient of the services that were provided at San Ysidro Health, right? I was born and raised in the South Bay. San Ysidro Health is a big staple in the community. They started off very young with 4 founding mothers, historically serving underrepresented communities. And I was one of those underrepresented communities. I was in the lower income spectrum, and I had to go to the clinic to get most of my services rendered, right? So I would go there to get my primary care visits, get all these services, and it would be at no cost, or essentially at no cost, right? $5, $10 for a visit. And since then, I started, realizing how much of an impact social programs create on disadvantaged communities. I went to Southwestern College, and then I transferred to the University of California in San Diego under a scholarship. And through that scholarship, I got the opportunity to participate in a guild that allowed us to kind of promote the program and recruit more donors for those services, right? So essentially helping those students that wanted to pursue the same footsteps that I did through a scholarship, through getting, full ride at a, world-class university. And having that exposure really drove me, and it motivated me to stay in the nonprofit world. So right out of college, I decided to go into healthcare. I was an enrollment specialist for the PACE program and left for the private world for a couple of years. It's not where my heart was, so I decided to come back, and I was given the opportunity as a marketing coordinator and eventually as a marketing supervisor. But I did forget to mention, when I was in high school, I did get an opportunity to work at the Adult Day Health Center, which is now the San Ysidro PACE site. It's the first site for our organization, and being there with the seniors one-on-one, talking to them, really listening to their stories, right? How many of these folks were veterans? How many of them had put their kids through school, through all of these, services? I had a lady that had both of her kids go to Juilliard and telling me the stories about that. So really realizing that a lot of these folks have been neglected in their care, and that there's programs like the Adult Day Health Center or San Ysidro PACE or San Diego PACE that allow for these communities to be better served and to be better represented. So the drive, the passion, the need is what kind of got me into healthcare, and I've been here for almost 2 years and a half, and I'm very excited, very rewarding experience, and just continuing to work at it. So that's what got me into healthcare. I know I extended it a little bit, but I'll hand it over to Laura. I'm sure she has a great story.
Thank you, Alan. So the way that I started in healthcare was mostly because of the way of how I looked at healthcare from a border perspective. So I used to live in Tijuana, and I used to commute every single day to go to school when I was a little kid. And all of my dental, glasses, everything, I could do it in the U.S., but it was easier for me to understand how it worked in the city of Tijuana rather than in the city of San Diego. So I remember starting my college experience, and I wanted to see where did I fit in terms of this spectrum of health, right? And I had a passion for psychology. And I pursued psychology, and it was amazing. And I saw that there was this huge need for behavioral services here in the county. And I thought, this is where I want to be. But then once I graduated and I started working the field, I saw so many seniors having so much difficulty trying to just navigate to get to a doctor's appointment, to try to see if the referral went in, got there, and they were turned away. And it just broke my heart. And I encountered PACE through my coworkers, and this is where I'm at now. And I love it. And it's been a journey. It's not quite been as Alan has said, but it's been quite an amazing journey to get here.
Well, I appreciate you both sharing your stories. And in healthcare, more than I think most industries, that purpose-centered employee person, right? If you're not drawn to caring for others, then healthcare is not right for you. And so it's wonderful to have two individuals such as yourself that have understood the challenges, the disparate network that is healthcare, right? It's this $1 trillion budget item that a lot of waste, and the individual really suffers. And so I think today what we'll uncover is how PACE programs really identify that person, singularly identify what their needs are. And so today on the show, I think we want to not only define what is PACE, which is, again, that program of all-inclusive care for the elderly. What are some of the biggest challenges in educating those that need these services, that just have to understand them and opt into that program? And then also the innovations thereof, and then also Medi-Cal expansion. So we will try to do all of that today in 1 hour. And as you know, incredibly hard to pack everything in. So get a pad of paper and a pencil and take some notes. And wherever you get your podcasts, wherever you go, please download the Healthcare Corner, because you're not going to want to miss a second of this episode here with Alan and Laura. So with the PACE program, how does it start? What patients are most at risk, Alan, and maybe how do you identify them so that they can now maybe be educated and understand if the program's right for them?
Of course. So there's a couple fundamentals when it comes to understanding PACE, right? And I think that your question is wonderfully worded when it comes to being able to kind of grasp what the ideal PACE participant would be, right? So in order for me to be able to dive a lot more deeper into that, I love for the opportunity to go into segment one when it comes to kind of talking a little bit about what is PACE, right? PACE is essentially the Program of All-Inclusive Care for the Elderly. That's what the acronym stands for. And our mission statement is to help people 55 and above coordinate their care to continue living safely and independently within the community, right? And within that model, we have what Sean Bloom, the CEO of the National PACE Association, calls the 4 C's of PACE, right? So the first C is that we are a community-based program, right? So essentially, most of our participants are housed in the community, living safely and independently. The way to think about PACE is that every PACE center usually services their participant at a no larger than a 45-minute radius to the center. And our biggest measurement to success is our ability to keep them in their home where they want to be living, again, safely and independently in the community, right? So that's our first C. Then the second C is the comprehensive level of care that we provide. And that's what truly makes us unique because we are one of the only integrated care models for seniors in the country. Essentially, when somebody comes into PACE and they enroll, they trust us and they agree in us identifying, organizing, and providing both their primary care, their acute level of care, and eventually their long-term care as well. So most of the work that is done in the PACE organizations is completed by PACE employees. We do contract out to some specialized, care folks. And the reason why we do contract out is because by federal regulation, we have to provide all Medicare and Medicaid covered services. So we also have to provide anything that is medically necessary to keep them safe and independent in the community. How the program is funded is the next C, if you may, which is that we are capitated. So the program is a full risk capitated plan. We received fixed amounts of payments through Medi-Cal and Medicare to serve all of the participants' needs, right? So the way that is done is that Medicaid calculates the payment that we receive generally by looking at what the model for the fee-for-service model would cost them at a particular state, and trying to get that lower than that. So that's the third C, and I can go deeper into that in the next segment.
And the fourth C, do you want to hit that really quickly?
Yeah, of course. So the fourth C is that we're coordinated. So our interdisciplinary team is the heart that pumps the blood through the vessels of our organization. They coordinate the care of our seniors, and I'll definitely explain a little bit more as we start going forward.
So I think that's a great overview of all those services. And again, as maybe for our older listeners, you'll understand that there's so many different aspects of care. And so what Alan has touched upon is the billing aspect, the coordination, looking at aging in place, which we've talked a lot about on the show. So get ready for another great episode here on the Healthcare Corner, and we will be back with Alan and Laura and PACE programming.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner. Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell.
Welcome back to the Healthcare Corner, everyone. And today's guests are Alan Tornel and Laura Gonzalez, and we are just ready to go on all things PACE. And so for those that are just tuning in, PACE is a program of all-inclusive care for the elderly. And in our last segment, we talked about really the 4 major components of PACE and what they do for those that are maybe interested in getting more care and understanding more services for them or a loved one. And so Alan talked about the 4 C's. And what I want to really bring up, which I thought was tremendous, was the comprehensive levels of care. And so when you're talking about primary care, acute care, and long-term care, those are all things that usually don't communicate well together. So I really want to emphasize for our listeners the importance of understanding what that means. And so we're going to start with this segment really talking more about that. And as our listeners know, I love bringing up statistics, and I'll link to this at hcshow.net. But when you look at a patient, especially in skilled nursing, that is between the hospital visit and an institutional level of care, if they go back to the hospital within 30 days, the average lifespan of that patient goes from about 5 years down to 18 months. And so what you're looking at is managing the communication, the coordination of that person really intimately during that acute care stay with the primary care and then the long-term care needs. So, Alan, maybe we can go into a little bit more about that and then continue this great discussion.
Of course. Thank you, Gavin. So Yes, as I was mentioning earlier, one of the big C's of our operation is the coordinated approach, right? That comprehensive level of care. And what we do with that comprehensive level of care is that we're able to provide everything and anything that is medically necessary to keep them safe and independent in the community, right? So our IDT team, which is the team that sees you, the team that assesses you when you're coming on board with PACE within that first month, is really, like I mentioned, the heart that pumps the vessels through the program. It's a group that meets every morning. They're talking about rehospitalizations, follow-ups, what's going on with the participant, which is huge when it comes to the statistic you were mentioning, right? So the lifespan changes drastically if they're getting rehospitalized into the system. And what PACE does and what PACE is able to provide through our model is we are able to eliminate that, not completely because we're obviously dealing with a frail and vulnerable population, but we're able to mitigate it very, very much. And just to give you an example, currently in our census, our hospitalization rate is under 1%. Because we're able to provide that comprehensive approach, that preventative model of care that our folks are not really accustomed to, right? They are usually accustomed to going to the emergency room, to feeling bad and going to seek attention. Here, we're able to get them before they're at that stage, before they get to that skilled nursing level of care, and could provide that environment that helps them thrive in the community rather than in an institutionalized setting, right? So that coordinated approach really is what makes us unique and what differentiates us from other models that are out there.
So I'd love for you all to let that sink in. A 1% readmission rate is absolutely tremendous. For some diagnoses, you're looking at 20-25% readmission rates. And so that coordinated care is incredible because as taxpayers, every hospitalization costs about $15,000. And if someone's living with mild to moderate dementia or Alzheimer's or related dementia, then that cost goes up to about $57,000 for that hospitalization. So the fact that PACE programming is supporting patients safely transitioning back into the community, you can't say that enough about that. So, Laura, I'm going to throw a curveball at you a little bit here, but I know you'll be ready for this. So, this sounds wonderful. As a nursing home administrator, I know the benefits of PACE programming, but what are some of the biggest challenges in helping those in the community really understand, gosh, this is the program for me?
Of course, that's a great question. And I think I'm going to answer it by saying that we as people, as humans, we get comfortable. And we like our doctors, we like where we go, it's the same clinic, it's the provider that you recommended by your aunt, anything like that. But when life comes in and starts bringing in all of these new changes in terms of your health, you have to consider what other options there are out there in the community. And I think that's where PACE comes in. And yes, there are some changes when coming into PACE that do change. And that is, first of all, because San Diego PACE or any PACE program is a health plan, the new name of the health plan would be that PACE program, right?
So if I was in Blue Cross, Blue Shield, or Kaiser or something like that, I would have to disenroll from that program and...
That's correct. And it's effective the first of every month. Yep. The next change would be primary care provider. We understand the fact that you've known your doctor for more than 20 years and they know your personal history and they know your grandkids. But when it comes, again, to the PACE approach, we are geriatric specialists. These providers don't sit down with you just 15 minutes. They take about an hour or more. They talk to your social worker. They talk to the physical therapy team. They evaluate every single need in terms of your care so that you can continue living safely in the community. And it's not just the surface level. We do go deep within, and we also have behavioral health services that can assist as well, and they talk to the providers too.
Are those deep dives done monthly or quarterly with your patients, or?
As much as necessary. But let's say if someone is being taken care of, it would be 3-month assessment or a 6-month assessment. But if anything changes or if there's a downfall in their health, of course, we reassess and we make sure that everything that their care is needed, of course. And then the third thing is in-home support services. So I'm pretty sure that the acronym most widely known as is IHSS. Mm-hmm. And basically that's when someone comes into the home and assists you with daily living or anything like that, right? Depends on your and everyone's needs. The thing regarding IHSS is we do our own assessments. when it comes to enrolling into the PACE program. And our home health nurse is the one that says, you know what, this person definitely needs caregiving services, but maybe less hours. Or maybe this person, because they are isolated and they're falling too much, they would benefit from coming to the daycare center. And instead of utilizing all those caregiving services, we're able to mitigate that through our day center, through our caregiver. And we also have our caregiver agencies that are able to reproduce those hours as well.
Gotcha. So I think the big distinction is with IHSS, that's typically a family member, right? So an adult child that maybe provides those services. And so what you're saying is that like the primary care physician, that relationship is then changed. And then under PACE, then if home care is still identified outside of an adult daycare need, that then it would be a different provider. So is there any case where that family member would then be able to become a PACE provider for that loved one?
Yes, and if I may jump in there, Gavin, that's a beautiful point that you made there, right? What is the caregiving hours that we need outside of our day center capabilities, right? And that's a common case with most of our participants, right? And another beautiful point that you touched there is what happens when a family member is taking care of that participant and that participant feels comfortable with that caregiver, right? And it can not only be a family member, it could be a friend, it could be somebody, that they're used to working with, right? And what does PACE do to be able to mitigate that? Talking on the perspective of San Diego PACE, we have a model called built-in caregiving model, which we are able to get these caregivers who are taking care of their loved ones already and have them hired through our agencies, assign them to that participants once they come on board, so they essentially don't have that discontinuation of caregiving services. Since every plan begins effective the first of the month, at the time that we begin the enrollment process, we also begin the built-in process so that it's a smooth transition and they can keep them as soon as they become effective in PACE. So essentially building around, the model and really the demographic of our people, right? We are in an area where there is a lot of multi-generational families, and the common recurring theme is that family members take care of their elderly, right? So if that's the case, we're able to help them and we're able to cover those needs as well. So
I think that's truly innovative. I saw it so much in the nursing home where we'd have somebody with us for a long time. There'd be a change of condition. They'd go to the hospital. Medication was changed. They came back maybe to a different room because of whatever reason. They had different caregivers. And then there was decline,
yes,
right? Because if we're comfortable with those around us and it's familiar, and there's any dementia involved, we know that the oldest memories kind of stay, but those most recent ones don't, right? So the anxiety, isolation, all that comes into play when somebody around you is not familiar. So I think that's the built-in caregiver model is truly interesting.
And I think that's wonderfully put, because that way, if the caregiver starts seeing all of these changes with the family and they don't know what to do, that's where PACE can jump in. They have all of these resources in the county and it's just localized in one place rather than them having to be calling all of these numbers or trying to figure it out online. They have this whole support system that we call a care team where we're able to do that.
And then before, one of the good things to mention also is that I'm sure that most of your listeners will be asking, so why do we have to discontinue IHSS if you're already providing that similar service, right? And the reason for that is because both IHSS and PACE are funded essentially by the same organization, the county, right? So it's kind of like double dipping if you were getting both services rendered by the same provider. Essentially what is, to take note here is the fact that IHSS is experiencing huge shortages right now, so you might not be able to get a caregiver within, a month or two or, an extended period of time. So with us, we're able to provide that caregiving service right away, and we're able to continue to provide it all along, their care. So that's a beautiful feature of our service.
And we've talked a lot about this on the show, and we've had representation from day programs and home care agencies and that sort of thing. Because of inflation and costs and everything that you're looking at, home care services can range anywhere from $25 to $40 an hour based on acuity. And when you're talking about 24/7 coverage for a loved one, you're talking $20,000, $25,000 a month, which most of us don't have. And so it's really important to understand, like Alan is saying, the nature of where these supports are coming from, so that you can say, well, gosh, is IHSS better for my loved one, or wrapping in all these other services at no additional cost to me or my loved ones? Maybe that's a better way to go. So Obviously, we're here with San Diego PACE. We want you to be able to go out and learn more. You can always go to hcshow.net, and we can give you more information about the national PACE organizations and that sort of thing. But really, to have experts like Alan and Laura here, they'll give you their information to you later in the show. So we definitely want you to stick around and learn more about how you can personally get that help here in San Diego. And I think the other thing that we want to talk about on the other side of the break is the importance of the adult daycare aspect, not only because it's a more cost-effective way, I think, for members to be able to get the important care that they need, but also the importance of socialization and reducing isolation risk and depression and anxiety and that sort of thing. So stick with us here on the Healthcare Corner as we will continue with Laura and Alan and all things PACE.
Awesome.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner with Gavin Wiswell. Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell.
Welcome back to the Healthcare Corner. And like many of our episodes here, there is so much information that you're getting about PACE. And I hope that if this is a program for you, if you're 55 and older or have a friend that is and needs more services and understanding, that you're writing all of this down and that you'll be reaching out to Laura and Alan at San Diego PACE afterwards. So these episodes, we're so grateful to be able to share all this information. We couldn't do it without our sponsors. So this episode is brought to you by Vertere Health, and Vertere is your post-acute virtual care partner. They specialize in remote patient monitoring for both mental and physical health, and you can contact them and find out more about their services at 855-745-8400 or visit their website at verterehealth.com. And so we're absolutely going to try and get so much in, Laura and Alan here, right? But what we talked about a little bit at the last part of the last segment was the abundance of services, I think facilitated primarily through the day programming, that a patient or a member can go to the day program, maybe see a dentist, a psychiatrist, and avail of a lot of services and get this really whole person support. Can you go into that a little bit more, Laura, please?
Yes, of course. So if you ever visit one of our facilities, which I duly esteem all the team for making it feel like home, it's a wonderful place to come. The doctors greet you. You're going to have an amazing time. It's a one-stop shop for absolutely everything. We have a dental office in our Vista Clinic. We have the day center, social services. We have nutritional services there as well. And when someone comes in, they get their blood pressure checked, they get their glucose checked, and afterwards they have some breakfast, they socialize instead of being home. Usually all of our seniors, they either live by themselves or live with family members that may work or they're not being tended to throughout the day. So instead of that, they have this alternative space where they're able to interact with others, have an amazing time. And if they're not feeling well, we have nurses available, there are providers available. And like you mentioned, behavioral health services. We have our own MFTs, we have our licensed vocational therapists, we have our psychiatrists as well, which they're internal through our San Isidro Health Company. They have all of these resources, and it's just a matter of letting us know. And once they're a PACE participant, they have access, and they're ready. The case management team, the social service team, the activities team, everyone is duly a wonderful human being that is able to assist whatever they can.
So many different services to avail of. I love that phrase, one-stop shop. I think it's totally applicable in this situation. And really the point of view that I'd like to start talking about maybe in this segment is talking about some maybe older models of care. When you're talking about skilled nursing facilities, occasionally I would get a call from a PACE program here in San Diego, whether it be yours or another one, and they would need to have one of their members in a short stay scenario with our nursing and physical therapy. And what I would tell every patient, whether it be one of your participants or not, is that skilled nursing should be a short-term stay. Everybody should want to get out of skilled nursing. and really save it for those people that need 24/7 nursing or therapy support. Because it's really, like you just mentioned, Laura, it's about getting back into the community, aging in place, being around those that they love, and having an opportunity to thrive at home or in the community that they were brought up in and love. And there's only so much that you can do in skilled nursing, and there's a great amount of people that care so much and care deeply for those that they serve there. But truly, if we could help support people get back into the community faster, what a wonderful thing. So, Alan, are there statistics of those that have maybe thrived outside of the skilled nursing environment? I really was excited for this segment in preparation for the show because I love stats and we would love to hear about the innovations and things going on. That's right.
Statistics is where it's at, right? It's where we know if it's happening or not. So yes, there is some statistics when it comes to that. I wouldn't be able to provide you those exact numbers right now. But what I can tell you is that we've had a huge success when it comes to rehabilitating and helping these folks transition into the community, right? So one of the limitations that we have is that we have to have a discharge plan in order for us to be able to enroll them in PACE while they're at the skilled nursing facility, right? So if they do have a discharge plan and they're looking to go back in the community, that's the demographic that we're targeting, right? We want to make sure that our folks want to live in the community, that they want to stay, like you said, where they were brought up, and are willing to work with us and being able to achieve that, right? So that's our demographic. That's who we usually target, but it doesn't limit us from providing that skilled nursing level of care if they were to get to that point.
And just as a nursing home administrator, just speaking for myself, it does come down to the finances, and it does come down to people having the right insurance to be able to be accepted by high quality skilled nursing facilities. Sadly,
Exactly.
That's a component of it. And sadly, that model is still Medicare focused.
Of course.
But I can share that the PACE rates were very competitive, that most administrators were fighting to get PACE participants in their building because they knew that they could provide great care and that there was a discharge. Mm-hmm. And so that was a highly valued patient for a skilled nursing facility to take on.
And I think that ties very, back into the one of our C's, right? The capitation model that we have. Given that we have a capitation model, what states usually try to do is that they determine what the Medicaid amount they're paying for a fee-for-service, individual that's usually in that same demographic and diagnostics, and that's what we would be getting for the Medicaid side. On the Medicare side, we put them in a risk adjustment model. We have them, input their demographics, their diagnostics, and that usually sends out a number. That's done through CMS. Usually for a PACE participant, that number is about 2.5%, 2.5, sorry, and that translates into that individual costing the county 250% above what an average Medicare beneficiary would cost them. So that determines the way that we're able to determine how much money we get through Medicare is we multiply that 2.5 times the average that it's costing the county for regular Medicare beneficiaries, and that's what sends us our rates, right? So that amount of money that we get is what allows us to negotiate really good competitive contracts with our providers like the skilled nursing facilities and like the other places that are out there that are providing similar services, right? Memory cares and these facilities that are out there. So that capitated model is really, really valuable, and it really helps. And it also ties into the fact that we're not only able to help those that are, Medicare and Medicaid beneficiaries. If you have somebody that's private pay and that is already going to a skilled nursing facility, and just by the skilled nursing facility paying $7,000 a month, then you can get them on a model like PACE, keep them in the community as long as we can. If it were ever to get to skilled nursing level of care, we cover that. And we also cover hospitalizations and any costs that come along with that. So as you were mentioning earlier, costs can go up to $25,000 a month on the low end. It just keeps going up from there. So our ability to capitate that and charge a certain fee really incentivizes and motivates us to provide everything and anything to keep them safe in the community.
And so when you're talking about that $25,000 with home care, that's for an unskilled caregiver, right?
Exactly.
And what PACE is offering is psychiatry, psychology, master's level social workers, dentists. You're getting the full spectrum,
Yep.
right,
Yep.
for that. So that's huge. So there's a couple of models I'd love for you to talk about with the couple minutes we have left in the
Yes.
segment. The greenhouse care model and potentially the Elizabeth Dole home and community-based services for veterans.
Of course.
and Caregivers Act?
So and thank you for bringing those up. The greenhouse and PACE collaboration model started in Southeast Michigan, and the name of the PACE program is Southeast Michigan PACE, right? It was started by, the program is kind of being led by Mary Neighbor and the Presbyterian Villages of Michigan. And what they're doing is that they created a 4-story building, right? And this is in Michigan, obviously, just to give you an idea of how creative PACE can get when it comes to developing these models, right? So 4-story building, they have 11 participants living in the 3rd floor. They have 10 living in the 4th floor. And the 2nd and 1st floor are basically PACE clinics and day centers. So the participants go up and down to the center. They can see their doctor. They can participate in daily activities Monday to Friday. So they get this communal style of living that is very different from the skilled nursing level or the skilled nursing setting, right? We usually tend to see that skilled nursing facilities have these long hallways. They were built a long time ago with a different model. So now what these folks are doing is creating a more communal living space that has, living rooms and has shared spaces that are able to provide all the services that you would through a regular facility. And they're certified at a skilled nursing level of care. So that's what allows them to be able to kind of get those folks that are already in skilled nursing facilities or that are about to be and transition them there, right? And the way that they're able to pay for that is that they negotiate a lower rate than they would pay for a skilled nursing facility otherwise, So that's the model that they're implementing in Michigan to be able to kind of serve those needs and adapt to the times, right?
So which is almost that bridge between senior living and skilled nursing, right?
Yes.
So you're able to step down, I guess, appropriately that level of care and still get the quality of provider that you do at a skilled nursing level, but not quite the cost. So it's a win-win really for everybody.
Yes. And different states have different models, different prices, different, regulations and all that good stuff. Not every state is allowed to have a greenhouse model, but there is different ways in which we can get creative, right? So what is currently happening in California is that PACE programs are partnering up with private companies and essentially negotiating a rate for the care that the patient is receiving on a day-to-day basis at their facility. They're itemizing that care, and then they're negotiating with the participant their SSI benefits, right? So essentially what happens is that PACE pays for the care at an assisted living or at an independent living facility, and the participant through their SSI benefits covers the cost of housing, right? So one of the things that we cannot provide on a continuous basis is housing, and the way that we're able to mitigate that is by creating partnerships like these, right? Where we're able to go in there, talk to these assisted livings, memory cares, and create a partnership in which we're able to itemize the cost of care, pay for the care, and have the participant pay for the cost of living and still receive all the PACE benefits, transportation, PCPs, hospitalizations. And these places like the assisted living and memory care facilities allow us to reduce cost of transportation, reduce ER visits by helping us kind of manage the patient there, and then essentially kind of helping them with anything that they need, knowing our model and our operational approach. So.
Alan, that's impressive, and just to have that recall just like that is amazing. For all of you listening out there, you're going to need to go to hcshow.net. You're going to want to download this episode. You can always email us at info@hcshow.net. Ask us any questions. If you have any specific questions for Laura or for Alan, please let us know and just join the conversation. Your questions drive great episodes for us here, and you are not going to want to go anywhere when we wrap it all up here about PACE programs here on the Healthcare Corner.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner. Don't go anywhere. You're listening to the Healthcare Corner. Welcome back to Healthcare Corner, where you're a part of the conversation with your host, Gavin Wiswell.
Welcome back to the Healthcare Corner, everyone. And if you're like me, I think that this hour has gone way too quickly, and we really need to probably have you guys back to the show, Alan and Laura. This has been incredibly informative, and it's that part of the show where you, the listener, get to really understand personally more of how you can connect and really reach out to San Diego PACE and Laura and Alan. So, Laura, if you'd share with our audience how they can get a hold of you, that'd be wonderful.
No, thank you, and thank you so much for having us. So again, my name is Laura Gonzalez at your service. I'm one of the marketing coordinators and focused in North County. My phone number, you're able to text me, call me at 619-392-0659. My email, laura.gonzalez at syhealth.org. And then our website, which I encourage you to please visit, is sdpace.org, or our Facebook as well, San Diego Pace. My supervisor's contact information, Alan Tornel's, is 619-218-5955. His email is alan.tornel@syhealth.org.
Yeah, and don't forget to visit us at any of our sites as well. If you are more of that, visual person that likes to see where you're going to be receiving your treatment firsthand, we have centers in San Isidro, Chula Vista, El Cajon, and Vista. They're all conveniently located, and we can share those addresses with the show here and link you to our website so that you can see those facilities firsthand.
And Alan, before the show, was gracious enough. So if you're one of those listeners outside of the state, he'd be happy to redirect you to the local PACE program in your area. As you heard, we've talked about programs in Michigan, and there are great programs across the country. Not as innovative as San Diego PACE, I would say.
Not.
but I would definitely say that he'll happily help you there. So hcshow.net, info@hcshow.net to be able to answer any of those questions outside of California. We'll get you connected with Alan and Laura. So in the last segment, we're going to do our best to kind of wrap it all together and give you 3 great pieces of advice that you can do right now, hopefully from each of us, in learning more about PACE or these programs of all-inclusive care for the elderly. But so much of it comes down to the billing and what do I pay for and what's the fine print and all of that. So maybe, Alan, would you like to maybe go into what's the really the out-of-pocket cost for participants?
So out-of-pocket, if you don't have Medicare or Medi-Cal, it's usually around $7,000, but we have to take into consideration that those $7,000 cover all your medical needs. If you were to need a transplant down the road, we cover that. If you were to have a dialysis treatment, we cover that. So it truly covers everything, and it encompasses all the services that you need. On the Medicare side, if you do have Medicare and don't have Medi-Cal, you would have about $3,000 share of costs per month. So those are the things that happen when you pay out of pocket. But in terms of Medi-Cal expansion, I did want to just plug it in there. Don't shy away from learning about the new regulations. There's a lot of changes happening in different states. So not only because you were denied in the past means that you're going to be denied in the future. A lot of regulations change. And just to give you an idea, the asset limit for folks changed from $2,000 to up to $125,000. So now they can add $65,000 per each dependent in the home. So it truly is changing the way that we're able to access our demographic, right? Historically, PACE has been for lower income, citizens, but with the new Medi-Cal expansion through the state of California, we're also impacting policy, right? And we're making sure that through policy, we're able to reach the most constituents that we can in our communities. And I think that this new Medi-Cal law that Governor Newsom implemented is really going to help us target those folks that were in the sweet spot, right? That weren't able to qualify for Medi-Cal without a share of cost, but we're also not able to pay outright for their Medi-Cal services, right?
There's that gap that you're talking about, right? You have those that have means that maybe wouldn't qualify, and you have those that don't, that do qualify. It's those in the middle that sometimes struggle the most.
Exactly.
So was I right in understanding that your program, San Diego PACE, is actually the second fastest growing in the state and 4th fastest in the country? Is that correct?
Yes, we are actually the biggest program in San Diego County, and that's surprisingly exciting for us because we are not the oldest program in San Diego County. So we are competing with folks that have been established in the area for a long period of time. And even though they have been, for longer periods, we have been able to continuously grow. And I like to point out, Gavin, that our biggest success and our biggest marketing tool is word of mouth, right? How we manage the services that we provide and how we're able to effectively deliver them to our participants is what really creates that change and what distinguishes San Diego PACE amongst the rest, right? We're the second largest in California. We're the 4th biggest in the nation. And the only reason why we're the second largest here in California is because the biggest one in the nation is actually right above us. That's encompassing the whole Los Angeles County. So that's why, right? But
the city of Angels is pretty large. So,
I know, right?
Yeah,
very, very suburban areas.
That's right. So with the time we have left, maybe we can go over just a couple of quick misconceptions and then get to our points.
Of course. So common misconceptions are I don't qualify for Medi-Cal. because I have a home, right? And that is not true. Like I said, assets, limits change. Your first home and your first car don't count. They're not taken into consideration. In terms of immigration, laws change. So all of those folks that have full scope Medi-Cal are now transitioning into full scope, and these folks have historically been told that having access to Medi-Cal is a public charge, right? So they're not allowed to do it because it would affect their immigration status in the future. That changed with Biden's administration. So now Medi-Cal is not considered a public charge, which gives access essentially to a large population of undocumented immigrants that have only had access to emergency services in the past, right? So again, I think that just circling back to your original question, the three main things that folks I think would help do is doing a self-evaluation, right? Trying to see what the needs they have are currently and seeing what PACE offers, right? Sometimes it's hard to let go of that PCP, but when you look at it in the perspective that, you're going to be receiving a new PCP that is focused on geriatric care, that's going to provide transportation, that's going to coordinate your hospitalizations, that's going to coordinate billing, that's going to coordinate everything for you, it truly is worth that change, right? So those are the three main things that I'd say would help somebody when it comes to finding out about PACE. Doing that self-evaluation, making sure that you get rid of the misconceptions that you don't qualify because of this and that, and actually reach out to us and have us assess you through a professional, coordinated approach. And then you be open to the changes. Like Laura was mentioning earlier, sometimes we're so used to our ways of doing things that we are hesitant to change, but sometimes that change comes for the better. And that change when it comes to PACE is accessing a whole wider network of resources that you wouldn't have had access to otherwise, right? So I think those are the three main things, and I'll hand it over to Laura. I'm sure she has a couple more things to add on there.
I'm laughing because you honestly touched on every single one I was going to say.
Oh my God, I'm so sorry.
No, I'm going to piggyback off of that and say, I encourage you to self-reflect, talk to your neighbors, talk to your family, see what's going on. Maybe you're in your current position in life, you're okay, but down the line, PACE would be a good option for you. And if you have any questions, Alan and I can make ourselves available for a phone call anytime. We are very agreeable people to talk with. You have our information, and please self-reflect on how you want the following 40 years, 30 years to be for your health.
Yeah, and in that self-reflection, don't shy away from writing down those questions that you really want to get answered, right? Can I get this covered? Will this help me in this aspect of my care? And let us know. Give us a call. Hey, Alan, is this covered? Is this going to help me with, this aspect? We'll make sure to answer all the questions you have, because as many things that we encounter out in the community, we receive them, we digest them, but it's not truly until we encounter that situation that we really come up with the questions that we want to get answered. So if within that self-reflection, you come up with some questions, feel free to give us a call, and we'd be more than happy to answer them.
Yes, and if you live in North County, I'll be more than happy to give you a tour of our facility. I'll be there, and I can answer any questions in person as well.
And one of my biggest takeaways was the 4 C's that you went through. In skilled nursing, we had 5 C's. Some people would say 6 C's, right, of really tight operations. But when you're looking at community-based care, that aging in place, that really comprehensive care, which I really think stands out of the primary, acute care, and long-term care, really understanding that, and then understanding the capitation and the coordinated team. Really, there's 15 different points that you need to consider with healthcare. So in that self-reflection that I think Alan and Laura are talking about, you're not necessarily always thinking about the importance of socialization and your recreational therapy, or how you're going to get from A to B. Is telehealth an appropriate option? What are the perspectives of my loved ones or the people that I care about, and how am I including them in my care? And so when you're talking about all-inclusive care, what I've heard is it's all-inclusive. There's everything there, right? I mean, and nothing is perfect. So I don't think this is necessarily a cure-all, but what it is an incredible step in the right direction, where now funding is starting to support more, I guess, advocacy for these programming efforts. And when you're talking about meals and labs and home care and hospital care, this is something you definitely want to consider. Alan?
Yes, and you put it beautifully, Gavin. Thank you so much for allowing us to be here and giving us the space, because it truly is an impactful program. And I'd give the opportunity for all of the people out there to really research our services and see what we can help out with. And one of the things that I love, but at the same time I'm a little hesitant about, is the list of services that we provide, because they're not limited to that. And that's the beauty about PACE. We are given the discretion to provide everything and anything that is medically necessary to keep our participants safe and healthy in the community. We've gone as far as to fumigate homes, build ramps to be accessible to our participants. So those things are not, that you see there in our webpage, are not what we're limited to. It's what we base ourselves off of. And I just wanted to give a quick shout out to my supervisor, my manager, Camille Oder, my director, Gerardo Perez, and our VP, Alicia Rodriguez, for being such creative minds in helping us develop partnerships that really serve our demographic, that are cutting edge and that are really innovative, and helping us cast that wide net and help those that are in most need. So thank you.
Absolutely. Really grateful that you were able to join us here on the show. And I think like others, we're going to need to have you back, right, in a month or so. So as per usual here on the Healthcare Corner, send us your questions. Let us know what you're thinking, because we want to make sure we can drill down even further into what is PACE for you as we continue this just overall conversation about health and wellness that we do here on the Healthcare Corner. So whether it be PACE programming or any other innovative services that are out there, the state of California is usually leading with programs like these to then be able to help in other ways. So what I do outside of just the radio show, we're talking about CalAIM, and they're just starting to talk about some of these concepts that are already happening in PACE. So if you need something now, reach out to Laura and Alan. And as always, it's great to be with you here on the Healthcare Corner, and hope you have a wonderful weekend.
To learn more about being a guest on the show or to ask a host a question, go to hcshow.net or email the show at info@hcshow.net to get your questions answered on the Healthcare Corner.